CEO of the SAMFund, and I'm joined by Michelle Landwehr, who just got married, so I'm still getting used to her name, our COO. And we're really excited about today's topic because it's one that, unfortunately, we hear a lot about on a regular basis. But before we launch into the presentation, I just wanted to go over a couple quick logistics. So this webinar is available free of charge at any time on our YouTube channel. It is being recorded, so if you need to leave early or if you know a young adult who might benefit from the information, please go to our YouTube channel, check out the presentation, download it, share it, whatever. Just make sure that people who are struggling with medical debt are able to access it. And it's part of our free webinar series called Moving Forward with Your Financial Health. So if you go to our YouTube channel, you'll also see recordings from all of our past presentations over the last few years. So everything from family building to managing student loans to dealing with prescription assistance challenges and all sorts of other stuff. So as you look over those, if there's anything else you want us to tackle in this webinar series, if there's something you're dealing with that we might be able to provide assistance with, please let us know. Send us an email anytime. Our contact info will be at the very end. And we want to hear from you. We want to make sure that this webinar series is as helpful to you as possible. So the only other thing I wanted to mention before we start is that you'll see on your screen in the GoToWebinar box that there's a little section where you can type in your questions. So either Michelle will be able to answer the questions as we go, or we'll take a break in between every couple slides that Monica is presenting to ask her the questions and let her answer them to the whole audience. If you happen to come up with questions afterwards, you can reach out to us anytime and we will find the answer from Monica and forward it along to you. But just know that you can submit them in real time and we will answer as many as we can between now and the end of the presentation. So I think that's it for general housekeeping kind of stuff. Oh, just one last thing. When the webinar is over, don't close the screen right away. We're trying a new way of collecting follow-up surveys because, again, we take your feedback really seriously and want to make sure that the presentation was helpful to you and see if you have any ideas for future topics or presentations. So don't close the screen when the webinar ends. Just click OK. You'll see a link and a follow-up survey, which maybe at most will take you a minute or two to fill out. The link to the survey will pop up. So please take a minute to give us feedback, and we'll follow up from there. So, okay, on to today's topic. At the SAMFund, we hear from a lot of young adults with a cancer history who are getting calls from bill collectors, whose bills are in collections, who are getting harassing phone calls from providers, and who don't know what to do. And so a lot of times, unfortunately, what we see is that young adults panic and open up a bunch of credit cards that'll damage their credit down the line, or they just don't pay the bills, which will damage their credit down the line. And so this is a topic that unfortunately is not uncommon. So all of you that are participating today, you're not alone in dealing with this. But we felt like if we can provide information earlier on, it might help you avoid the medical debt in the first place, certainly avoid it going to collections, and just help you get a better handle on things before it becomes a crisis, because we know what it feels like when that phone rings or you don't even want to open your mail because you're afraid of what you're going to see and you just don't have the money to pay for these bills. So we are so happy to welcome back one of our most favorite partners, Monica Bryant, who's the COO at Triage Cancer. You can check out their website at triagecancer.org. It's a national nonprofit dedicated to helping survivors, caregivers, and healthcare professionals navigate cancer survivorship issues. They're a fabulous organization. They're one of our best partners. They do a lot of great work in the healthcare space and provide a lot of education. Monica herself is a cancer rights attorney. She's a speaker. She's an author. She does so many things for so many people, and she's fully dedicated to improving access to and availability of quality information on healthcare-related issues. So as soon as we realized we wanted to do a webinar on this topic, Monica was the first person that we called. We are so happy to have you back, Monica, for this webinar, and we'll turn it over to you.
Thank you so much. I'm so happy to be here because, again, I really do agree with everything that Sam just said in that it's so common for young adults once they're diagnosed with cancer to sort of have this overwhelming boulder on their shoulders dealing with medical debt. And while there's no quick solution or easy way out, so to speak, there are certainly some things that can be done to help minimize the long-term impact these bills can have. And again, this is such a hard topic to talk about for a lot of survivors. I always start with a cartoon. So here's a guy talking to his insurance company saying, there's an error in my bill because you accidentally sent it to somebody who has no money. And I think that is unfortunately a very common sentiment. And Sam did a great job talking about Triage Cancer. If you'd like more information about us, you can find us on our website, triagecancer.org, or at the end of the presentation are all the different ways to connect with us over social media. So jumping right in, there are so many factors that can contribute to an overall feeling of financial instability, and that's because there's often changes to your employment status during and after cancer treatment. So perhaps you had to take time off for treatment, perhaps you had to leave your job entirely, maybe you moved to part-time. Either way, you're likely feeling that change in your employment status in your wallet. It can often be next to impossible just to pay your monthly bills, let alone keep up with all these extra medical costs that come up. And because unfortunately, a cancer diagnosis doesn't also come with a pause button, it's often the case that in addition to your cancer journey, you may have experienced some life changes like finishing at school, starting or ending a relationship, moving, and these are all things that can have an impact on your finances. And then, of course, the reason we're all here today is the high cost of treatment, which often means large medical bills. We know that having health insurance can make a huge impact in your financial health, but even those with health insurance policies may find that their policies don't cover as much as they thought it would. And prior to the Affordable Care Act, otherwise known as healthcare reform or Obamacare, once someone was diagnosed with cancer, it could be next to impossible to get health insurance. Now, thanks to the Affordable Care Act, as of January 1st of 2014, insurance companies can no longer deny selling somebody an insurance policy just because they've gotten sick. So there are several benefits in the Affordable Care Act that I'm not going to go into great detail with, but it is important to know that there are some additional options that can help make sure that people have adequate health insurance. And we'll talk a little bit more about that in a couple minutes. But even having access to better quality health insurance isn't going to completely solve the problem of high medical bills. So we're going to spend the next hour or so talking about medical bills and how to deal with them and your overall financial health. But before we can get into the specifics of addressing medical bills, we have to talk about looking at the big picture of your finances. Because if you don't know what you have and what you owe, you can't make completely educated decisions. And that's what we're all about, right? We're all about giving people information and resources so that they can make the most educated decision for themselves. Now, this spreadsheet is something that we created at Triage Cancer to help people figure out their financial big picture. So on the right-hand side, you see a list of items. So a house, car, wedding ring. You know, not all of you are going to have all of these things, but I'm just giving you examples here of things that you might want to include in what we call your financial big picture. So do you have a car, bank accounts, retirement accounts, maybe a personal belonging, an expensive painting or something like that. So once you've figured out your assets, you also have to look at your liabilities. So we're talking about your debts here. Your car loans, your student loans, mortgage, credit card debt, and of course, any medical debt. Once you've pulled all this information together, you're going to have a sense of your net worth, which is just going to be your total assets minus your total liabilities. And because at Triage Cancer, we have a deep, deep love for our spreadsheets as a way for keeping things organized. Here we've also included columns for account numbers, login information, contact information, and any notes you might have about a specific account. This way, all the information is in one place and is easy to keep track of. And this is something that you could update, maybe once every 6 months or even just once a year if that's all you can manage. But it can also be a really helpful document if you're thinking about estate planning, or if you're ever in a position where you need somebody else, like a financial power of attorney, to help out with things. You're not sort of sending people to a shoebox to try to figure out all of your different accounts and how to log in and all of that. So again, this is just one way to do this, one example to do this. If spreadsheets aren't your thing, there are many other ways to do it. the bottom line here is you have to take stock. So you have to know what you own and you have to know what you owe. And then you have to reassess your financial picture. So even if you had a financial plan prior to your cancer diagnosis, you need to figure out where you are financially after treatment. So figuring out what your big picture looks like can help you decide if you need to take specific steps, and it can also help you identify priorities. So maybe your first priority is finding a job. Maybe you're nowhere near that stage because you have to prioritize opening that stack of bills that Sam was talking about. Perhaps you're in a place where you're through the deepest part of it and you're ready to start thinking about building your savings back up or contributing to a retirement plan, paying off student loans. So again, figuring out your personal or your next steps is going to be really personal to your situation. But these are just some questions to get you started thinking. So what's the current status of your finances? And the spreadsheet we just talked about is one way to answer that question. Were you able to keep working through treatment? Did you need to take time off? And how did that affect your financial situation? Maybe you finished treatment. Are you back at work? Were you able to go back to the same job with the same kind of paycheck? Or did you have to find another career path with maybe a slightly smaller paycheck or bigger paycheck? Do you have a stable income? So that's sometimes the first question that should be asked. Which brings me to a good point that these are not in any particular order that you need to think about them in. You really just need to think about all of them. And then what are your reoccurring potential expenses? What assets do you have? So again, we've talked about assets a lot, and that's what goes into that financial big picture. And then finally, what secured and unsecured debt do you have? So secured debt are going to include things like a car loan or a home mortgage. Exactly what it sounds like. It's debt that is secured by something. So if you stop paying that debt, the thing that it's secured by gets taken away. If you stop paying your mortgage, the bank can take your house. Unsecured debt are going to be things like student loans, personal loans, credit card debt, where if you stop paying, yes, there are going to be some consequences, mainly in the form of your credit being hurt, but they can't take away your home because of it. And then once you have the answers to some of these questions, we can kind of move forward in the process. Another very important part of figuring out your financial big picture is figuring out what your credit looks like. Now, there are two things that you need to consider when thinking about your credit score and your credit report. Your credit score is a 3-digit number determined by looking at 5 main categories of your financial history. So they look at your debts, your new credit, your length of credit history. So are you somebody who's had credit for 25 years, or have you only had credit for a year? The type of credit used. So do you have 27 retail cards open, like Gap and Banana Republic and all of those. Or maybe you just have a Visa and a MasterCard. That's going to play into it. And then finally, your payment history. That score is then used by lenders to predict your financial risk. The most widely used score is the FICO score. And FICO scores range from 300 to 850, but some other scores actually go as low as 280. The higher the number, the better your credit worthiness. And there are 3 main federal credit bureaus that I've listed here. And your score can even depend or be different for each credit bureau, so keep that in mind too. There are some smaller credit reporting agencies that provide specialized services that report payment for like phone, electric, and cable. But really, the biggest thing you need to look at are from these 3 major federal credit bureaus. So now, your score is only part of the picture. You also need to look at your credit reports. The items on the report will help the bureaus determine the score. So the reason it's important to look at both is you want to look at the report to make sure that everything is accurate, But then you also want to make sure you know what your score is so that you can figure out, where you stand on this excellent, good, so on scale. These people are often surprised to learn that your credit can be checked when you rent an apartment, lease a car, buy a home, or even cable television. Also, some potential employers can conduct background checks that include looking at your credit score or full report, and they can make some judgments based on what's in that report. Now, fortunately, of all the things I'm going to talk about today, I personally think this is the easiest thing that you're going to do, or you could do, and it's asking for your credit report. So each of the 3 national credit bureaus are required to provide you with a free copy of your credit report once every 12 months, but you have to ask for it. So to order a copy of your credit report, you can visit annualcreditreport.com or call this number. Excuse me. Now, there are a lot of commercials online that say, oh, we're going to give you a free credit report, just put in your credit card number. Be careful because those aren't always actually free. Generally what they are is they're free for the first month or 60 days, and then they'll start charging you moving forward. Once you receive your credit report, check to make sure that all the information you have is correct. If not, you are entitled to ask for the credit bureaus to fix the information. Now, I did say to be careful of any credit reporting agencies that are saying, oh, pay us a fee and we'll give you a report. However, the reporting agencies are only required to give you your report. The score isn't attached to that report. So you may get a report that just shows all your open lines of credit, but doesn't actually give you a score. They are entitled to ask you to pay a small fee in order to get the score as well. However, several credit cards are now offering this as a free service and just providing you your score each month. The credit bureau is allowed to report the most accurate negative information for 7 years. So negative information could be things like you missed a payment on your credit card. So they can report that kind of information for 7 years. And they can report bankruptcy information for 10 years. And that seems like an awfully long time, but you may be able to use that information to your advantage. For example, let's say that you're trying to buy a car and you need a loan. 6.5 years ago, you negotiated a settlement to close a credit card for less than you actually owed. That will show up negatively on your credit report and will lower your credit score. However, it can only be reported for 7 years. So provided you're in a situation to wait a few more months, it might be smart for you to wait an additional 6 months before trying to get that car loan so that item is no longer on your report and you can get a better deal. If you are having a problem getting the information corrected or there's something else going on with your credit report, the Federal Trade Commission is the entity that deals with these types of issues and can be a really good source of information about credit scores and reporting. So their website is ftc.gov. Now, periodically, FICO releases new versions of its scoring that calculates various types of debt differently. So for example, FICO 8 weighs high credit card limits more than the sporadic late payment. That's saying basically if you have a history of having high credit card balances, you are less creditworthy than if you've missed a payment because you were scatterbrained. Now the most recent version, FICO 9, I think is the most interesting for the cancer community because it made significant changes in the way that it looks at medical debt. So this was released August of 2014, and in previous versions, FICO didn't distinguish between medical debt and other types of unpaid debt. Also, previous versions didn't take into account debt paid after it reached collection. FICO 9 the idea is to put less emphasis on unpaid debt due to medical bills as compared with other types of unpaid debt. And it won't take into consideration accounts and collections that have been paid. So I bring this up just to show you that things are constantly changing, and there is an acknowledgement from the financial community that medical debt is a real thing and doesn't always accurately predict somebody's creditworthiness. So for more information, if you're curious about these FICO scores, myfico.com is actually an outstanding website. Okay, so after you've assessed your financial picture, including looking at your credit score and report, the next step is going to be to create a budget. Now, you've already started the process with your financial big picture, but I'm asking you to take it one step further in terms of your budget, because here I want you to actually look at your day-to-day expenses in addition to all your other debts. Because the idea here is if you don't know what you can spend towards your medical debt or your medical bills, how can you possibly figure out how you're going to handle it all? So also in this budget, it's really important to try to project any expenses you might have. And I realize that that is incredibly challenging when we're talking about a medical condition. But let's say that you have been diagnosed with a type of cancer where you know for the next 5 years you're going to need a mammogram every 6 months. You can get an idea of how much that's going to cost you by looking at your old bills. Same with things like MRIs or even just doctor's visits. You know, I know generally every time I see the doctor, I have to pay about $100 out of pocket. So if I need to see the doctor every 2 months, I need to, put aside about $600 just for doctor's visits. Again, it's not a perfect system, but it's a way to try to get ahead of the bills rather than always chasing after them. Now, if you want to create a budget on your own, by all means, I say go for it. If you're like me and you're not really a numbers person, I would say remember that you don't have to reinvent the wheel when it comes to budgets. There are literally thousands of free templates available online that you can download and customize. And there's also several software options like Quicken or even smartphone apps that are relatively inexpensive that can help you create a budget. But you might be completely uncomfortable or overwhelmed with the idea of doing a budget on your own, and that's incredibly understandable given everything else you're dealing with. And we recognize that sometimes creating a budget isn't always as easy as it sounds, and you can maybe be left feeling like this couple who's sitting at the kitchen table discussing their finances saying, well, we can pay off our past and save for our future as long as we avoid the present. If you have similar sentiments, a financial planner might be the best option for you. So financial planners work with people of all income levels, so don't feel like you have to have, Steve Jobs type of money to utilize one. You can visit the National Financial Planning Association to find a planner near you, and many planners will even provide an initial consultation for free with no commitment. You may also want to consider contacting a consumer credit counseling agency that can provide you with some tools like financial calculators, budget worksheets, and other resources. These counseling agencies may also be able to help negotiate payment plans for you or settlements with your with your creditors. But remember, if you negotiate a settlement with a creditor, it could negatively affect your credit. Now, this is one of those really personal decisions again. Maybe you're in a position where you know you're not going to need credit anytime soon because you already have a mortgage and you just got a car. So it might be a smarter decision for you financially to reduce your debt now and absorb that 7 to 10 year hit on your credit. Or maybe you've already had a challenging financial picture, so your credit score is not so great, and so, a few more points lower isn't going to make or break you, but reducing your overall debt is really going to help you. So again, it's really tough for me to even, a lot of times people will say to me, what do you think I should do? And I can't make those judgments for you. It really is a very personal decision. So this goes back to knowing your credit score and what's in your report. And I urge you to talk this through with a professional before you make any drastic decision, because especially for young adults, it's particularly challenging to anticipate where you're going to be in life in 7 years. So I just hate for people to make decisions solely based on the now. Okay, so you kind of looked at your financial picture, and now we need to talk about specifics of dealing with medical bills. And one of the best ways of dealing with medical bills is to avoid them to any extent possible by making sure that you have adequate health insurance. Too often I hear from young adults that they got the cheapest insurance plan that they could, because that's all they thought they could afford. But what they didn't necessarily realize is that although the monthly premiums were the cheapest, the plan itself actually ended up costing them thousands because it didn't cover enough, or because of the high out-of-pocket maximums. As I mentioned at the beginning of the presentation, the ACA has made it easier for people to purchase adequate insurance. And for more information about the ACA, we have a ton of resources on our website, triagecancer.org. But I do quickly want to talk about why math matters when you're looking at health insurance plans. In the Affordable Care Act marketplaces, there are 4 main levels of plans that you can buy. And they differ based on how much the plan will cover and how much you are responsible for. So a bronze plan is one that will cover 60% of your healthcare costs, and you're responsible for 40% once you hit the deductible. Then it goes up from there by 10. A silver covers 30, a gold covers 80, and a platinum is going to cover 90% of your healthcare costs, and you're responsible for 10% once you hit the deductible. But as I mentioned, this is a situation where math matters. So oftentimes bronze plans have the cheapest monthly premium, but the highest deductible. Whereas the platinum plans are going to have the most expensive monthly premium, but the lowest deductible. So why does that information matter? Here's an example of 3 different level plans. Bronze is at the top, gold's in the middle, platinum's at the bottom. On first glance, it may appear that the bronze plan is the cheapest because you only have to pay $105 a month. But what you have to look at when you're looking at plans is that you have to pay the entire deductible before the plan starts picking up whatever portion it's going to pick up. So in the bronze plan, you have to pay $5,250 before the plan even starts covering their 60%. Now, if someone rarely uses the healthcare system, then maybe the bronze plan is a great idea, right? They're just going to pay their monthly premium to have their insurance. Maybe they're going to see the doctor once or twice a year, and they're going to call it a day. My guess is most of you wouldn't be on the call today if you didn't see the doctor with some sort of frequency. Chances are most of you are going to hit the out-of-pocket maximum every single year. So I urge you, when you're picking a plan, is to figure out what the plan is actually going to cost you for the year. And the way you do that is you multiply the monthly premium by 12. Told you math wasn't my strong suit. You multiply the monthly premium by 12, and then you add the out-of-pocket maximum to get the full cost. So I'm hoping some of you have started to do the math in your head, but I'll help you along a little bit. As you can see, the bronze plan actually costs somebody $6,830 for the year. Whereas if you look at the platinum plan, it's only going to cost the individual $4,348 for the year. Now, I fully recognize that $4,000 is nothing to sneeze at, but if you stop and think about how much more you could be paying if you didn't have adequate health insurance, that's actually a very small number. So I realize that we're still a few months away from open enrollment, and you have the health insurance that you have, and some of you may already have medical bills that you need to deal with. But I wanted to bring this up because having health insurance is a lifelong commitment, and so it's important to understand how to pick the best plan for you. So in that same vein, important to make sure that to the extent possible, you pick a plan that has the doctors that you see in their network and covers the prescription drugs that you take. So for many of us that live in states who have marketplaces run by the federal government, you can get the information right on their website. So where you see the arrow on the bottom, you can click and see all the providers that are covered and the list of drugs that are covered. Now, I will say this, the information may be outdated, so it's always great to double check, but it is much easier than it used to be for us to get this information. And then getting the health insurance is only half the battle. The other half is about making the most of the policy that you do have. So some quick tips for people really trying to maximize their policy include using in-network providers wherever possible. Sometimes it's tricky because out-of-network providers may creep in without you even knowing. For example, if you had surgery, the surgeon and the hospital may be in network, but the anesthesiologist might be out of network. It's not always possible to avoid, but at least you can try and you can request that all the providers be in network. It's also really important to be vigilant about reviewing your bills. Remember, it's just people who are doing the coding and billing in your doctor's offices, and people make mistakes. So check your bills to make sure you actually got all the services you were billed for. The other thing that we've been seeing lately is preventative services being billed incorrectly. So for most individuals, you should be getting certain preventative services for free. If you're unsure, ask. It can never hurt to ask. And then lastly, a great way to maximize your policy is to leverage out-of-pocket maximums. So here's an example of how this all works. If you have a plan where it has a $2,000 deductible, and once you hit that deductible, the plan is going to cover 80%, but your out-of-pocket maximum is $4,000. So let's say you have a $102,000 hospital bills. What do you actually owe? You have to pay your deductible of $2,000. So what's left? $100,000. Well, then you're responsible for your co-insurance amount of 20%. So that's $20,000, which is a ton of money. But the good news is, since you have an out-of-pocket maximum of $4,000, you're only responsible for paying $4,000. So $2,000 of your deductible and $2,000 of the $20,000. So the way that you can leverage all of this is, first of all, by knowing this information. And let's say you hit your maximum this month. Maybe you want to make sure that you go and get any other medical care you need this year. Do you need other checkups? Do you need a surgery? Do you need certain prescription drugs? You know, have you hit your family out-of-pocket max? Because if you have, then I definitely suggest that everyone in the family goes and gets a checkup this year, as opposed to waiting until next year when you have to hit your deductible and out-of-pocket max again. So if you time it right, you might be able to save a significant amount of money. Now, I'm certainly not advocating getting services you don't need or delaying care just for this reason, but I'm just saying if you understand how the system works and you're aware of where you are in the year, you can really use this to your advantage. Now, I focused a lot on sort of the general things that you can do before the medical bills racked up, but now we need to narrow back in a little bit for existing bills. Now these two guys are sitting on a park bench and they're talking to each other, and one says to the other, "My doctor told me to avoid any unnecessary stress, so I didn't open his bill." And I think this guy's taking a very interesting coping strategy, but it's not one that we necessarily recommend. That being said, there are some things that you can do to reduce the burden of medical bills. So I recognize many of you are post-treatment, but I do want to talk a little bit about lowering bills before care, because they may be relevant for any follow-up care you might receive or any general future medical care. People don't often realize that you can, in fact, negotiate your hospital bill. Most hospitals have a billing department and even patient navigators that can help you with this. When it comes to getting lab work done, not all labs charge the same amount. Get a list of the tests that are going to be performed and shop around for the lowest prices. The same goes for any test that you're going to get done. Healthcare Blue Book is actually a very interesting website where you can put in your zip code and the test that you're receiving or the care that you're receiving, and it will give you the fair market value of that care in your area. So you can actually figure out, are you being grossly overcharged for something? If you can, try to group follow-up appointments together so that you're only paying one copay and one office visit fee. And now this might not be possible all the time. I fully recognize that, but you never know until you ask. A lot of times doctors and medical facilities are not thinking about things from the perspective of your finances, so you oftentimes have to be the one to bring that up and to be your own advocate. And then there may also be times when taking a generic drug instead of a name brand could be less expensive, or even a less expensive course of treatment. But if you never discuss finances with your healthcare team, they might just give you the option that they're used to giving you. Again, the disclaimer here, please make sure this is not a purely financial decision and that you've adequately discussed the generic option with your doctor. I would never suggest taking a less effective course of treatment for financial reasons, but sometimes there is equally effective treatment and one is significantly lower in cost. Now, once you've received care, you're probably going to get a ton of correspondence. Just from your insurance companies, you could get 3 different pieces of mail, one saying they received a claim, one saying they're processing a claim, and then one called an explanation of benefits. And you can usually tell an explanation of benefits, or EOB, because it will say in large letters somewhere, this is not a bill. But this is the document that's going to show you or give you an idea of how much you're going to have to pay out of pocket. It'll tell you how much the insurance company is going to cover, how much the charge was reduced because maybe you used an in-network provider, and then finally how much you're responsible for. Now, these EOBs can be very challenging to decipher, and there are a couple of websites that can help you, and I've listed them here. Now, the last piece of information you may get is going to be from your provider directly. This could be the hospital where you got care, the doctor's office, or the laboratory that did a test for you. The amount here is generally the amount that you're responsible for. But again, I'm going to say don't take that as face value. And also realize that these pieces of mail don't always come in this order, which is why it's critical to keep track of the paperwork. So just an example, last week I received a bill for my daughter's checkup for the full amount of the visit. Now I know that the insurance should cover at least a portion of that visit, but I hadn't yet gotten the EOB, so I wasn't sure how much insurance was going to cover. So although the bill from my provider's office had a due date that was close to passing, I didn't want to overpay the doctor and then try to figure out how to get something back from them. So I called the doctor's office and explained. They pushed back the due date, and they asked me to call them back when I got the EOB. When I got the EOB, it showed that they were going to cover a portion. So I called the doctor's office back, told them that I had the EOB that said they were going to cover something, and the doctor said that they were going to go ahead and re-bill me when they got the check from my insurance company. So it's a few extra steps, and it's kind of annoying, but it could save you quite a bit of money. As a side note, during all of these conversations, the way that I organized things was everything was stapled together, and on the bill itself, I wrote who I spoke to, time, date, and the outcome of the phone call. So in that same vein, we strongly recommend reviewing your medical bills. Medical bills may keep arriving long after your treatment is over, and it's important to stay diligent and check your bills for accuracy and dispute them if there's problems. If you believe a procedure or treatment should have been covered, know that you have the right to appeal that decision. Most insurance companies have an internal appeals process, and every state, thanks to the ACA, are now required to have an information about the appeals process on the resources page of our website. Now, if you have extensive bills, you may want to consider talking to a professional bill reviewer or medical claims organization. So MedClaims Liaison is one, Co-Patient Inc. is another. Each review service is set up a little differently. Some will charge you an initial fee, like Chapman Consulting charges you $300 up front, and then 25% of everything they recover past that. Whereas co-patient just takes 35% of everything they get you back. So please keep in mind that I'm not endorsing any of these services specifically. I just wanted to give you some examples of different ways that companies come at this a little differently. And while a professional bill reviewer may be helpful, you should still try to create an organizational system for your bills. There are some that already exist. So Cancer 101 is an example. LiveSong has a survivorship notebook. Whatever you choose to do, 3-ring binders, even just stapling the EOBs and the bills together and putting them in a shoebox is a start. The shoebox method is not the best method or the most preferred method, but it's a start. Please also keep track of these expenses and mention them to your tax preparer if you have one, because they might be deductible. So meals, lodging, travel expenses, long-distance phone calls, those are all generally deductible. And keep the records of these expenses for at least 3 years in the event you're audited, but to be on the safe side, I would say to keep them for 6. Now, if you're in a situation where you have creditors, whether they're hospitals or landlords, try talking to them. And we suggest doing this before they turn over your unpaid bills to collection agencies. If you can't make the payment, ask for more time. Check to see if they'd be willing to negotiate a payment for a lower lump sum. But again, please be careful when you're looking at solutions that might negatively affect your credit. Also, it's not recommended to take out a loan in your home, otherwise you're going to go second mortgage or home equity, to pay your medical bills. Because what you end up doing then is turning your unsecured debt into secured debt, and you risk losing your home if you can't make those payments. And because the reality is that even if you do everything right and try to deal with your medical bills, there often still isn't enough money in the pot for everything. And that's when you might want to think about looking for some financial assistance or alternative income options. There are different types of insurance coverage that you may currently have for your employer or that you purchased on your own, which can provide financial assistance. The first is disability insurance. This is insurance that provides employees with some income while they're unable to work due to a medical condition. There are private, employer, state, and federal disability insurance plans. And I'm going to talk a little bit about the 2 federal plans that you may be eligible for depending on your status. So in order to be eligible for one of the 2 federal plans, Social Security Disability Insurance, SSDI, or Supplemental Security Income, SSI, you have to fit within the definition of disability under the Social Security Administration. And that is, you cannot do your job, you cannot adjust to a new job, and your disability has or is expected to last for a year or longer or result in death. Now, I've included the slides here that give you some more specifics about Social Security insurance. I'm not going to go over them in depth, but just I wanted to give you the information, and know that we have several blogs and another webinar available for more information about SSDI and SSI. I also wanted to mention that for some folks, there might be income options for caregivers. So a few states have state paid leave for caregivers, and many states have something called in-home support services. It's called something a little different in each state, but it's generally run through the Medicaid program, where if you're acting as a caregiver for an individual coping with a serious disability, you might be eligible to get some income from that. Now, the other sources of income I wanted to mention might be some sort of outside the box things. So do you have a disability or supplemental health care policy through your employer, or a private policy that you bought yourself? Aflac is a great example of this, and I'm sure we've all seen the commercials. Excuse me. So what these plans do is they pay for certain expenses and make up for the income lost because you can't work due to a cancer diagnosis. Now, even if you've completed your treatment, you might be able to get reimbursed for things that you paid for while in treatment. So contact your insurance company or your employer's human resources representative for more information. Also think about, can you adjust your tax deductions? So maybe you're getting more each month up front in a paycheck. Contact your mortgage company or your credit cards. A lot of times they have programs where they will suspend your payments for a few months if you have a disability or you lose your job. Do you have existing accounts like 401ks or retirements that you can use as collateral for a loan to help with some of the immediate costs? And then finally, another interesting asset you might not realize you have is a life insurance policy. So sometimes life insurance policies allow you to use them as collateral to borrow money. Sometimes they contain waivers so you can stop paying the premiums while you're unable to work because of a disability. And then there are some companies out there that will let you or will provide you with loans using the policy as collateral, but it doesn't actually reduce the amount if you were to pass away. So Fifth Season Financial is one example of that. Another way to use life insurance policies is a viatical settlement. A viatical settlement is when you sell your policy to a third party, typically for less than the full policy amount. But what you end up doing is you get cash on hand. So if you have to pay off bills and you're less concerned about providing for a beneficiary down the line, that's a good option. And then when you're looking at additional sources of funding, applying to financial assistance programs might be appropriate. So, of course, there are fantastic cancer organizations like the SAMFund, Hope for Young Adults with Cancer, local, state, and county organizations, private programs. You know, and although the bulk of your treatment is over, there might still be medications you need to help manage side effects. You know, and some financial assistance programs may help with medical expenses, may provide insurance, may help with other bills. And then I'm also going to say, and I say this all the time, but don't underestimate the power of love. So your friends, families, neighbors, coworkers, you know, I bet you anything you've heard countless times, let me know if there's anything I can do. And it can be awkward to say, well, I need some help paying my bills. They may not realize that just because your treatment is ended, you still need some financial assistance. So you could have somebody set up an online fundraiser through a website, like GiveForward or GoFundMe, to help you raise money to pay for medical bills or living expenses when you're getting back on your feet after treatment. But I will just say, if you have not been public about your cancer diagnosis, then these fundraising options might be a little bit more limited. And it's something to think about before you jump right in. We talk a lot about disclosure and making educated decisions, and this is one of those areas where sometimes people don't always think about all of the ramifications. And when you're looking for resources, again, you might have to think creatively. So maybe you can get assistance with your utility bills, so you can use that money to pay for your healthcare costs. There are programs out there to help pay for your co-pays. Prescription drug assistance might be available. So organizations like RX Hope and MediMeds can help you find the pharmaceutical company programs to provide people who are having financial difficulties with their medications. So again, you might think, you know, how on earth am I ever going to pay my mortgage? Well, maybe you can use some of the money you set aside for your prescription drugs to pay for your mortgage if you can get your prescription drugs covered. So it can be oftentimes a little bit of a balancing act. Again, thinking outside the box, there are programs to help with transportation, lodging expenses, parking, gas. And then finally, there are some programs to help deal with education debt. The issue of paying for student loans is often very pertinent for young adults coping with cancer. And the good news is that some private student loan companies will allow you to change payment plans or postpone payments based on a disability. Federal student loans also have a system to forgive loans if you qualify as having a permanent and total disability. But just keep in mind that any amount of loan forgiveness you might get can be considered income on your federal income taxes. So again, you have to kind of think big picture. Is it better for you to have less income on those federal income taxes and have the ability to access some other benefits, like maybe Medicaid, or is it better for you to get the loan decrease? Also, some jobs offer loan repayment plans as part of their benefit packages. So if you're in the position to negotiate your package with an employer, this might be something you want to think about. So again, I've included a couple other slides just for the sake of completeness that I'm not going to go through. But know that a lot of this information can be found both on the SAMFund's website and the new financial toolkit page and on Triage Cancer's website. So with that, I'm actually going to say, are there any questions, Sam, that we should take?
Yep, we actually had a couple, so I'm glad the timing, I've been watching the clock because I was trying to figure out the right time to interrupt you, so this is perfect. So we had a couple questions that came in a little bit earlier having to do with basically what to do if you figure out that there's a mistake. You talked earlier about the reviewing your medical bills for accuracy and things like that. So what happens if you do review it and you find that there's a mistake? Can you go over sort of what the process is for that?
Sure. So it's going to be a little bit different depending on the provider, but generally the first thing that I would do is contact the provider themselves. So let's say it's your doctor's office and there's a mistake and they're charging you for a visit that you never had. I would call that billing department and just say, I see you charged me for this visit. I have no record of this visit. Can you double check it? If there continues to be, if they're adamant that no, you got this service, I would go up kind of the food chain in that organization. So if it's the hospital, get a supervisor and go from there. We talk a lot about advocacy, and this is one of those areas where you really do have to be your own advocate. If you cannot get it resolved and you are sure there's a mistake, you can always go to most states have an insurance commissioner that you could go to if the issue is with the insurance company. So you could go up that level. And if it's a more specific question than that, I would say go ahead and contact me and I can help you figure out exactly who you should go to.
You actually just answered the second question as well about insurance, so that was great. So the next question is about what to do if your bill does land in collections. I know I mentioned earlier on that we hear from a lot of people whose bills go to collections and they have no money coming in, so they have no money that they can pay the bills with, and so they either just ignore the mail or they open up a bunch of credit cards and max them out, and both of those things obviously will impact their credit down the line for a while. So if things, for whatever reason, end up in a collections situation, what are some steps that people can do to get out of that?
So if you can pay the bill, obviously pay the bill. Generally, that's not usually the most feasible option. So I would say the next step would be to go to that consumer credit counseling agency I talked about. Each state has one, and ask them to help you negotiate with the collections agency to figure out how you can deal with the debt so that it doesn't continue to be a negative mark on your credit, and that you can start that 7-year sort of healing process.
Excellent. Let me see if there were any others. Oh, there was one about whether an HSA or an FSA is really worth it. What's your thought on that?
I'm sorry, I couldn't hear.
Sorry, if an HSA or an FSA is really worth it.
Great question. It's going to be a very personal decision. I can say, you know, I have a flexible spending account, and for those of you who don't know, a flexible spending account, similar to a health savings account, are accounts where you can put money in pre-tax and then use that money for medical expenses. Now, I believe the amount that you can put in this year caps at $2,500. But the idea here is that you're putting in the money pre-tax from your paycheck, so the value of that money is a little bit higher. If you, again, are going to the doctor a lot and are using a lot of healthcare, then I think flexible spending accounts are a great resource. Different ones are set up a little bit differently, so some employers will even match what you put in. So my thought is generally don't leave free money on the table, and utilizing an HSA or an FSA is a good way to avoid doing that.
Great. So we have a couple more that just came in. We're going to try and get to all of them. Again, if we don't get to your questions, we'll stay in touch with you over email after the presentation. Somebody asked whether hospitals review your credit score in relation to your bills. In other words, are they more apt to give you a greater discount if your credit score is lower or higher?
You know, that's a really excellent question, and I'm not sure I know the answer to it. My gut reaction is they could, because they could look at it as, well, if you have a pretty good credit score, you're probably creditworthy and you're willing to stick to a payment plan that we come up with. But I don't know 100%. So that's something I would actually probably want to talk to some hospital administrators about and get a real answer for you.
Great, excellent. And then the last one was on whether you had any recommendations for free online budgeting websites.
I don't, but here's why I don't. Everybody needs something a little bit different. So my suggestion is to just Google free budget templates and kind of just click through the first couple that you see and see which ones make sense to you. Because I could recommend one that might be way too complex or way too simple for your specific needs. So that's why I don't want to recommend a specific one. But if you have questions, like if you can't narrow it down between two and you're not quite sure, feel free to shoot me an email and I'd be happy to kind of talk it through with you.
Great, and I totally lied because there's one more.
Okay.
So someone asked a question that she just signed up for insurance and got tested 2 days before they said she was covered. So presumably those bills are going to go through before insurance kicks in. Is there anything she can do about it now?
Start the question again.
Sorry, so she signed up for insurance and got tested 2 days before they said the coverage began. So she's wondering if there's anything she can do now. She said it was a grandfathered policy.
I'm going to say reach out to me so I can get more specifics about that particular situation. Generally, if you get treatment before your insurance coverage kicks in, they're not going to cover it. But I don't quite understand the part about being grandfathered. So I think that sounds like a pretty specific question that I would want more information about.
Okay, no problem.
So if that person can email you guys and you can pass it on to me, that'd be fine.
That's great. Perfect. Okay, I think we are right at 4 o'clock in our time zone anyway. So we will end the presentation here. If you guys think of questions afterwards or, we didn't get a chance to get to your question, you can email us at webinars@thesamfund.org. We can follow up with you directly if you've already submitted the question, and we will definitely be in touch. We're sorry that we weren't able to get to all of them. You guys had some great questions. Monica, we want to thank you so much for doing this webinar. This is a topic, unfortunately, that is not uncommon in especially the young adult cancer community, and we're so grateful to you for providing this information and guidance so that hopefully we can help people avoid the medical debt scenario in the first place. So we love having you as our partner, and we appreciate the time that you took to do this webinar. Thank you so much. To everyone who participated, thanks for giving us an hour out of your day. We appreciate it. We hope this was helpful to you. So again, like I mentioned in the beginning, you can check back either at the samfund.org/webinar or on our YouTube channel, which is youtube.com/samfundtv. You'll see the links on your screen right now. And you can listen to the recording of this webinar, which probably will be up in a day or two. If you know somebody who's struggling and would benefit from the information, please share the link with them. And again, finally, when the webinar is officially finished, please take a minute or two to complete the post-webinar survey. It's going to pop right up on your screen. Don't close the window. Just click OK and answer a few quick questions for us. We appreciate it. And if you have ideas for future topics or any other feedback you want to share, please feel free to email us anytime at webinars@thesamfund.org. So on behalf of Monica and Triage Cancer and everyone here at the SAMFund, thank you guys for participating today, and stay tuned for our next webinar. Thanks.